including pollutants, including antigens. I'm going to use the word, another word that is antigen. You see, and antigen ki hum baat kar rahe hain, so there is antigen. Regarding antigen, there is air pollutants. Now I am using the word air pollutants. Pollutants. And once we talk about air pollutants, so there is antigens, and these antigens may be present on the surface of bacteria. This may be purely a botanical origin like pollens and so on, etc., etc. Now, you are quite familiar with the history of asthma. With Islamabad, you see there are particular type of plants are there, that is mulberry, and it's going to expel the antigens into the surroundings. So the air is now polluted, and once there is weather reports are there, weather reports. So there is now another criteria, that is pollens. Do pollens exist in the air or otherwise? उसमें आजकल जो वेदर रिपोर्ट आपको मिलता है उसमें पॉलेंस का भी एक वो एलिमेंट होता है कि पॉलेंस nil or 0. You see, that is why sometimes people ask for rain or other rahmat. Why? Because it is that rain that trickle down. Once it goes and trickling down, so it's going to trap. These are air pollutants, and that goes and settle down. And once all these dust etc. material settle down, so the atmosphere is clear, and there's respiratory disorders. So nowadays respiratory diseases are there. So that is why I opted to go for these respiratory drugs used to act on the respiratory system, particularly respiratory disorders. Now recall mast cell, you see, and if I recall for you the mast cell, so the mast cell secretes heparin, you see, and the classical one is histamine. Histamine is there, and there is 5-hydroxytryptamine. 5-hydroxytryptamine is there. Slow releasing substances are in anaphylactic shock, and other materials are there. So tryptophan. Now histamine produces bronchospasm. And then the antigens, you see, there are certain antigens that also triggers this release of what you can say from the mast cells, and there is increasing the responsiveness of trachea or the bronchioles to pollen particles. Thus asthma is number first allergenic in nature. Asthma first is allergenic in nature. 70 to 90% cases of asthma are allergic in nature, book says. So the first dominant triggering and provoking factor for asthma is allergen. I'm using the word antigen, or the best terminology is allergen. And this allergen, this pollens may be one of the allergen, you see. Now, if this is the story, so this will constitute your remedy as well. There is bronchospasm as well. And there is bronchospasm. And once bronchospasm is there, so there is wheezy chest. And once wheezy chest is there, so there is west-like phenomena. The third one is, since spasm is there and mucus plug is also there, so if mucus is here, so there is a reflex phenomena to get rid of that, and there is ciliated epithelium. Epithelium is ciliated. If I write for you, this is ciliated epithelium. So the gallbladder secretes mucus, and the mucus traps this foreign particles. So once there is ciliary movement and upward movement, and then there is a cuff reflex phenomena, so the mucus is cuffed out. So there is persistent cuffing with expectoration. And number 4, the respiration rate is increased. And number 5, the ultimate effect is this hindrance to the oxygenation phenomena. So cyanosis may be there. Now, if you understand all these things, Now you can understand the now what should be the treatment remedy? Treatment of asthma. Yes? Anyone, Shabas? Keep in mind these things. Asthma is allergenic in nature. If asthma is allergenic in nature, it means you need anti-allergic. You need? So number first, anti-allergic must be there. And anti-allergic drugs mean drugs that is going to counteract histamine. So antihistaminic may be there. Anti-allergic or antihistaminic may be there. And antihistaminics, they have their own classification, like diphenhydramine, which is Benadryl, Cell company banati hai. So you will give anti-allergic drug. This is triprodine. So if you go and see the range of antihistaminic, so you will find different range of antihistaminic drugs like triprodine, which is present in Actiped, and you see there is diphenhydramine, which is Benadryl. You will find chlorpheniramine maleate, and the difference is in the selectivity plus the half-life. You see, and there is loratadine as well. Loratadine. This is long-acting, and non-sedative. So you will give antihistaminic drugs. First is that you will give antihistaminic drug. The second is that since bronchospasm is there, so you know bronchospasm is produced by histamine. So antihistaminic will and anti-allergic will relieve and will antagonize the next on release of the histamine. But remember, when histamine is released and in the tissue there is histaminic receptor, if there is histaminergic receptors is here on the tissue, histamine receptor, and histamine now comes and attached. This is histamine. So histaminergic receptors are here. And you are quite familiar with the terminology of histaminergic receptors with the concept of agonist and antagonist, you see. And agonist for this histaminergic receptor will be histamine. It is having affinity, specificity, and will trigger the activity of this receptor. And here, that, as you know, that produces bronchospasm. So, in case of respiratory tissues, it's going to increase and then decrease the heart rate. This is by basic action. So cardiovascular system is also affected. Now, what is important? If histamine comes and attached with this histaminergic receptors, so what happens? Until and unless these histamines are not metabolized, then it is very difficult to dislodge this histamine from these receptors. So keep in mind, once you give antihistaminic drugs, so already histamine come and attach with receptors that will keep on continuing producing allergy till this histamine is metabolized. But why still antihistaminics are important? Because the release from the mast cell is a continuous phenomenon. So once you give anti-allergic, so further release of histamine at least will if it's there, so it won't come and attach and stimulate the other H1 receptors, which is better. So that is why this is important. The second thing is that you prevent the release from this mast cell, and this is drugs like Zetofen, Novartis company banati hai, and that is drugs that is going to inhibit this release of histamines. So they are also called as mast cell stabilizers. Mast cell stabilizer. What is ketotifen? Yes, its name is ketotifen. Ketotifen is the generic name, and this is the trade name, Zetofen, from Novartis company. So what is important? Important is that you should stabilize this mast cell, that there should be no further release of histamine. And if already released histamine is there, it is very difficult to dislodge. So you should give antihistaminic now as well. And now antihistaminic antihistaminic drug is here. This is antihistaminic. And the histamine is at present won't be able to come and attach with this. So in the presence of antihistaminic drug, so now antihistaminic is important, stabilization of muscle is important, remember, and this is important. You see, what is bronchospasm? So you sometimes need mucolytic as well. Mucolytic, mucus is there, so you will give mucolytics plus expectorant. So there are mucolytics, there are certain expectorant drugs, but if antigen are on the surface of bacteria, you see, or if it is involvement of pollen to produce asthma and with secondary association of bacterial involvement, keep in mind that, then bacterial infection are also there. And if bacterial infection are there, then you need antibiotic as well. When antibiotics are required, when there is bacterial infection, is high grade fever is there. This is an indication that there is involvement of the secondary bacterial infection as there. Now this constitutes your modalities of therapy for different clinical approaches. So you need an anti-allergic drug, you need antihistaminic drugs. Which antihistaminics? It depends upon, because sometimes the child is irritable, and so in this particular condition you will need an antihistaminic with having sedative phenomena. But if your person is a productive person for the family and he is going for work, so you need a non-sedative antihistaminic in this case. And so the selection of antihistaminic is now this rationale is based on the person professions and his her need as well. Second, you have to stabilize this mast cell so that there is no further release of histamine, and for that you have to give ketotipin, and market drug name is Zetofed, and there are other different branded drugs are available that you are going to inhibit. So you need in some time typical asthma, managing typical asthmatic attacks, and attacks are frequent. So the physician now combine this ketotipin plus antihistaminic, and since spasm is there, bronchodilators, you see, so you will give bronchodilator as well. And regarding bronchodilators, we have discussed that in autonomic nervous system in detail, and these are beta 2 receptor stimulants, and regarding that, we have salbutamol, we have terbutaline, you have albuterol. We have discussed that in detail there. So salbutamol is present with the name of Ventolin, terbutaline is present with the name of Brecanel, albuterol, and that's Premax, you see, that is with Abbott is preparing this. So half-life is again important of these bronchodilators. And there is theophylline as well. Theophylline derivatives. Theophylline. T is a classical example. That's going to get. So in nutshell, for asthma or cardiopulmonary diseases, you see, it depends upon the clinical scenario of your patient, that how the clinical condition of your patient is. For example, there is asthma associated with fever, with respiratory disorders, you see, and having a prehistory of asthma. So sometimes the physician says his chest is very big, is busy, and now you have multiple strategy. First, if you receive a patient with a acute onset of bronchospastic attack, so you have to reverse the bronchospasm, and for reversal of this bronchospasm, directly you give bronchodilators, and for that you give sometimes nebulization of salbutamol or terbutaline with a particular rates, you see. And once the bronchospasm is reverted, your patient is made stabilizer, then you have to give these bronchodilators, oral preparations, and which particular oral preparations you see. Again, it will depend upon the type of the patient. For example, if it is school-going child, and if it is an old age patient, you see, and you are working and there is no other person looking after, so you see, for a school-going child who is leaving school 7 o'clock in the morning or home, and going to school and coming back to the